Welcome to Elevate Care. I'm your host, Kerry Perez, and I am thrilled today to have our special guest. It is our CEO and President of AMN Healthcare, Cary Grace. Cary, welcome to the show.
Thank you. And we get this great opportunity to be the two Carys today.
I like it. Cary and Cary.
It's wonderful.
Awesome. Well, Cary, I've had the pleasure of getting to know you over the past year and some change. But for our listeners and viewers who haven't had that chance, can you tell us a little bit about your personal journey to how you got to be CEO and President of AMN Healthcare?
Yeah, of course. I joined AMN Healthcare actually 2 years ago this week. And my journey leading up to coming to AMN, I had been a longtime leader of very large global businesses that really had three core components to them. One is they typically were growth businesses and had a growth story behind them. The second is they were businesses that had an impact. And so they had a solution set that was incredibly meaningful and important in the sector that they served. And the third was that they had really strong brands and culture. And so when I was approached about coming to AMN, and I really looked at those three core tenets, AMN had all of those. And particularly right before I joined AMN, and really for 15 years before that, I'd spent a lot of time around healthcare and really helping drive better healthcare outcomes, and also around global human capital and had run a really big business in that. And so the intersection for me of joining an organization that really was about the future of healthcare human capital and how we could make that better for the entire healthcare ecosystem was really appealing. But really the decision point for me was culture matters, and AMN has just such a great, strong, values-based, mission-based culture that really was the driving decision for me, coming over here.
Excellent. So you mentioned, kind of a long history within healthcare. What's your sort of kind of position on the healthcare industry, where it's been, and maybe AMN's role in creating the future of healthcare?
So I am the daughter of two healthcare professionals. My mom was an OR nurse. My dad was a dentist and a psychologist. And so my dad was my first boss. Mm-hmm. And so I worked in his office. I was, just had the extraordinary opportunity to experience what it meant to be a healthcare professional, growing up with two just incredibly dedicated examples of that. And all of, my community and our friends were very aligned around healthcare. And so I got to see a lot of what was great about healthcare and a lot of the things that really needed to change. And so as I think about where we are in healthcare and in the industry is we really collectively are grappling with how do we meet the increasing demand, largely driven by an aging population. So you have demand increases, you have all types of new innovations around care. They're not accessible equally to everyone. So there's a lot of questions around access and equity. And there's a lot of questions around, do we have a broad and deep enough clinical set of professionals to be able to meet some of those rising demands? And so the challenges are significant. The opportunities against that are also significant. And I think it's actually one of the most important, if not the most important issue for our country is around healthcare and, really driving continued quality outcomes in an affordable way and in a way that, really provides access.
AMN is going to be celebrating our 40th anniversary this next year. As you look back, and kind of coming into this space and with all of your history, how would you, in your own words, sort of describe the evolution of AMN?
Gosh, 40 years is such a huge milestone. I feel so lucky to be leading AMN as we celebrate this milestone. I'll give you a framework of what I think has sustained AMN's leadership and really kind of leading in innovation throughout those 40 years, we have been customer centric. So we have been focused on what do our clients need? What are their goals? How do we help them achieve their goals? Where are our clinicians? How do they want to work? How do they want to live? How can we enable more clinicians to be fully engaged in the workforce? And so this constant focus on ensuring that we have the needs of our clients and our clinicians at the forefront, I think has really been at the forefront of what has been the cornerstone of AMN's success. And so you see that from, we started 40 years ago as a travel nurse company and, really built that industry from nothing. We have evolved from there into a more diversified total talent solutions company. And if you think about the era that we're in now, it really is around how do you become more tech-enabled, both in your organization, but in your solutions that are supporting these really big healthcare providers. And so it's quite exciting where we are and really exciting where we're going. The other big piece that for as long as we have been here, it's actually quite a proud thing, is our culture really hasn't changed. And so all the things that we do and all the innovation that we've accomplished, the heart of who we are is still so rooted in our values around inclusion and trust and purpose and partnership. And so all of those great things about who we are has fueled our ability to, throughout 4 decades, be a leader and an innovator. And I really do think it's going to be a really big fuel for our success in this next era.
You mentioned a lot about our values. You started talking about, technology and sort of the evolution. Can we dive a little bit more on that important intersection of tech and people and, keeping the heart of healthcare present?
Yeah, so the way I would describe whenever I get asked about, technology, and there's so many conversations around how critically important technology is to the future of fill in the blank, right? It's across every industry, and it's certainly true in healthcare. And I believe that people are always going to be the heart and soul of healthcare. It's who we're serving. There is always going to be the most critical element that is going to be people-based. But it will be an and with technology. And so technology should be helping our healthcare professionals to be able to spend more time in what brings them great joy and where they are the most impactful, which is the care for patients, the ability to use technology to free them up, starting from whether they are in a leadership position, whether they are in a direct care position, whether they are behind the scenes, that it is making us better and allowing us to focus on the things that matter. It's interesting, my daughter started out as a pre-med major, and one of the things very early on, I think it was like her first, practical at the hospital, and they basically framed it up and said, the great thing about your role is there's always going to be a need for people in healthcare. And there are certain roles in some industries that, 20 years from now, that might not actually be the case. People are always going to be at the core of great healthcare delivery. Technology will increasingly enhance that.
I love that, because sometimes it can feel like just talking about tech only can feel over rotating. It's ever present. It is important. It's so important for our future. But the and that you mentioned, I think. It's tech and people. And I just think an important message that we don't overlook. The other thing that you spoke about when you were talking about the evolution was about how we have, met clients where they're at and sort of evolving with innovations. Is there anything in particular that you're kind of most proud of or you feel like is most impactful?
I have the great privilege of getting to spend a lot of time with our clients and really with leaders across the industry, as well as with our clinicians, and getting to hear from them. A couple of themes. First, and I'll start at the broadest piece, and it really goes back a little bit to your earlier comment around the tech piece and the innovation. I think we've seen, or it's felt like there's been an acceleration of that conversation the past couple of years. Mm-hmm. And I think that's acceleration's happening because we really had 3 years during the pandemic where every healthcare system was really just trying to get through this generational, pandemic that none of us had really ever experienced. So there was a fair amount of pent up demand for innovation coming out of that I think the acceleration that a number of us feel is real. Mm-hmm. And so we're trying, as an ecosystem to get caught up to the opportunity after 3 years of being incredibly focused on mission critical work around the pandemic, and now getting back to, in our case and what we do with our clients, how do we help them build sustainable quality workforces? Mm-hmm. And so that has huge impact for me around those conversations and how we help them do that. The stories that are so incredibly exciting to me are anything that really showcases the power of what's possible and the power of people. And so that ranges from, a client coming to us and saying, hey, you promised that you were going to help us get this type of cost savings or this type of quality outcome. And you not only did it, but you surpassed it and you made a huge difference to, our ability to achieve our mission. I love those stories. Mm-hmm. I've gotten a letter from the governor of a state talking about an interim leader and how that leader helped them get through literally a huge healthcare crisis that they had. I have international nurses that we have helped them come over to find meaningful roles in providing healthcare in some of, just incredible communities across the country. And the stories not only of what they're doing in those communities, but the story of how we're setting up their family and generations of their family to come to have a different life, literally makes me emotional even thinking about. And so the beautiful thing about what we do is we make a difference and we can have an impact. And that looks very different depending on what part of our business you're talking about, but the impact is meaningful. Mm-hmm.
So everything that you described kind of comes down to me to a word about partnership. And not just a staffing company, not just a line item, but a true sort of partner that enables all of those stories that you just mentioned. What does being a partner mean to you in that lens?
There's a couple of truisms for me about partnership. One is you have shared success. You also have shared failures. And so it's hard for me to think of examples where you've been truly innovative, where everything has gone perfectly. And, true partnerships are really defined as much of how you go through some of those challenges together as the successes. It's easy to be a good partner. It's easy to be a good fill in the blank when everything is going well. Real partnership, real relationships are defined in the challenging times. We saw that in spades in the pandemic. We stood by our clients. They were our priority. They were our priority coming out. We had aligned goals. And so you really being there and being there for them throughout all types of conditions is a true partnership.
Can we extend that partnership definition to those other constituents?
100%. And so, I shared earlier, my heart is with our clinicians. So it's it's literally where I was raised and who I was raised by. And so, you just think about what we have asked healthcare professionals to do and pick whatever time frame you want to pick, but they are the heroes in this narrative. And they get up every day and, and they certainly did over the pandemic. They put the needs of others before they put their own needs first. And I look at part of our role is also to make sure that we are caring for the caregivers, and we do this in a number of different ways. But the clinicians are the heart, literally, of what we do, and we care about them. And we care about their professional success. We care about their personal well-being. And we want to be their partner, literally, from the moment they enter their profession to the moment that they retire.
Yes, I was going to pick up on that thread of trust. What are some of the other characteristics that you think define a good partner that AMN upholds?
Trust, integrity, transparency are the hallmarks, I think, of really strong partnerships. And the trust piece is built. And again, it comes from you going through all different types of business environments together. And not you just saying things, but you delivering.
You are diving deep into kind of partnerships. When I think about AMN, we have just such a broad and deep set of solutions. What does it look like to deliver on those for our clients?
Yeah, it's interesting. Delivering our solutions around total talent starts with what the client needs. And so we have some clients who come to us and say, my biggest challenge and my biggest need is around language interpretation. And so we meet them and we solve their biggest need. We have clients who will come to us and say, I need help immediately on, on managing all my clinical and non-clinical contingent spend. And so I need the technology to do it better. I need the solutions to do it better. We help them with that need. And we will help clients in whatever model they want. Some clients want to have the technology and do more of it themselves. We love that. Some clients want the technology and the services and want us to operate it. We love that. And so we really start first and foremost with what a client needs. We answer that need and deliver and help them. And then as we develop that relationship, as their needs evolve and they typically grow, we continue to help them with more of the things that matter to them and their priorities.
I think that really embodies and brings to life, our goal of being their workforce partner in the mission of care, and that it's not a one-size-fits all. And so whatever their mission is, whatever their focus is, we are there to kind of meet them where they're at from that client-centric perspective. Being at AMN for 18 years, it is part of our culture, and it is something that I've really taken a lot of pride in, that we do the right thing. So that is who we are, but also maybe some other proof points or thoughts around how our structure as a public company helps us to enable to be, that trusted partner.
Yeah. And I agree with you. I mean, you almost have to experience our culture to really understand what you and I are both reflecting on, but it's a really big reason why I came. We had all of the what in terms of the great capabilities and the brand and the relationships, and that's all what we do. Who we are and how we do things really matters, and it matters to our clients and our clinicians. And so as a public company where we are incredibly transparent, you see everything about our business line on a quarterly basis. Really, there's no other organization in our industry of our size that does that. We have independent governance, whether that's from our board, whether that's from regulators, that it's not just that we are who we say we are, There is independent governance around everything about how we operate, which really is important for healthcare systems to be able to pick a partner that is going to match them in terms of what they need from a capability standpoint. But I'd say particularly as it becomes more tech-enabled, having the confidence around the governance and the transparency around how the company is operated that gives them that confidence of picking a great partner.
Right. And, just the compliance, the SOC 2 type 2. I know it's just like such a hard fact, but that is important, especially as things become more tech enabled, to your point.
Yeah, it's interesting. I could, as you were saying SOC 2, I was thinking, gosh, I could come down with a list of kind of alphabet soup of all the phenomenal things that we do that we've built because we care about having, just a broad, deep set of solutions. But what I'll say in shorthand and not kind of, and there's a number of things besides SOC 2 that I would kind of add to that is we really do take very seriously how we ensure that we are going to have the highest quality, innovative solutions for our healthcare organizations and do it in a very transparent, very, strong governed way of how we operate the business.
I wanted to give you an opportunity too to maybe talk about impact or purpose for community and the AMN team members.
We always talk about community, and your communities can be defined, in all different types of ways. And one of the beautiful things about AMN is we have so many communities, right? We have our community of AMNers. We have a number of resource groups within the organization where we have very strong alignment to different communities that speak to people and speak to individuals. We develop communities for our clinicians. We started to do that in our clinician app so that we can help clinicians connect to each other, whether that's in, geographies that they may be in or interests. And so for me, one of the other really great things that we do is we have a incredibly passionate group of team members at AMN who, when they leave their kind of work environment, their community and their involvement in the community is extraordinarily strong. I ran into somebody today who is on the board of Big Brother, Big Sisters. We have a celebration going on where we bring clients in and we're doing medical kits for the Dallas-Fort Worth community. The list of organizations that we are engaged with that are making the world better for everyone is incredibly impressive. It's one of the things that I am just so proud of, to be a part of this organization, that we care. And the care is felt collectively when you come into AMN, but we have just extraordinary people here who want to make a difference in the entirety of what they do in their lives. And it shows in what we do in so many different ways, big and small, in our communities.
I really felt that. That felt palpable, what you were saying, of just the authenticity behind that and knowing you personally. I really, believe that. So with that and all of the change and kind of AMN's role in it, what is your hope within the next 5 years for, AMN and the healthcare staffing industry as a whole?
Yeah, my hope is that we continue, if we were going to look back 5 years from now, that you would have healthcare systems, healthcare providers saying about AMN and about our industry, they were critical partners to helping us achieve our missions. And individual missions may vary some, but the common elements in the missions are really about quality patient care. And my hope 5 years from now is that, and I'll put AMN at the top of that list, is really cited as the partner in helping those organizations achieve their missions.
So at the end of the day, AMN is in the business of a labor market. What are some of the trends that you're seeing right now?
If you look at the highest level, we have increasing demand from a patient standpoint that we expect to continue. So you'll see different numbers around that. Most people think there's probably going to be a mid-single digit increase in demand, driven by, I mentioned this earlier, an aging population. And so we see that demand continue to increase. There's not enough supply of clinicians to be able to serve that demand. And so that's what these interesting conversations around how do we continue to find ways to attract more physicians, nurses, allied professionals into this space. How do we help those clinicians that are in the space today in a really healthy place from a well-being that they want to stay in? And then importantly, how do we continue to train up the next generation of clinicians? So the same demographic that is driving the increase in healthcare in aging population, you also are going to have a number of clinicians, the most experienced clinicians, retiring from the workforce over the next 10 years. And so we really see, an opportunity to find ways and solutions that are going to make that clinical workforce more efficient. How do we find ways that through scheduling or through workforce management, that in tech enablement on the clinical side, that we make the clinicians that we have much more effective in being able to do the work that only they can do and preserve them against this growing demand. And so we still see that macro supply demand thesis intact. And we see really significant hiring of health systems, particularly post-COVID, that has happened over the last 18 months as they've built a more sustained workforce. And so we think that the workforce is going to continue to be, if not the top issue, among the top issues for healthcare systems.
Before we maybe kind of go into closing, is there anything that we didn't touch on that you'd like to leave with our audience? Maybe how you want people to describe AMN, how you want people to feel, or anything that we haven't touched on?
Even as you were doing such a great job, you could be a professional in this. I think you really are. We're at this inflection point in the industry. It's such an interesting time. There's a big cyclical component that we certainly experienced over the past 3 years. But beyond that cyclicality of the business, there's just really important conversations and innovation happening in this space as we speak that I think is incredibly exciting and is going to be impactful as we think about certainly how our organization, but how the industry can have a really positive impact on the future of healthcare. And that's very exciting to me. It energizes me. And I think where I see the most opportunity and progress is really those organizations and clinicians that are going to continue to, in a very high energy way, embrace that future.
Cary, thank you so much for a great discussion. It was a pleasure to have you on the show.
Well, thank you for having me.
Awesome. We will see you next time on Elevate Care. Thanks for listening and watching. Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.